Hey, this is Dr. Ty from Premier Orthodontics, and in this video today we're going to be going over a before and after case of a patient that had a Herbst appliance. So he started off with a large overbite. We're going to show you how he started, why we decided to choose a Herbst appliance for this patient, and show you his final results as well. So if you haven't yet, make sure to like and subscribe and tap that bell for notifications. So we'll go ahead and get started here. So this is our patient. You can see this young man still had some baby teeth in. He was pretty young. I believe he was around 10 or 11 at the time. And you can see he had a pretty pronounced overbite. So what we'll tend to see is sometimes patients' lips will get caught right underneath those front teeth. And what that tends to do is it pushes the lower teeth back and pushes the top teeth forward, kind of making that overbite even more pronounced. So you can see from the picture of him smiling, that's exactly what's happened. That habit is formed from getting that lip stuck in there when they're young, and that just tends to keep compounding and getting worse and worse. So when he showed up, you can see he had quite a few baby teeth left. The parents were very concerned about his overbite. He was having some confidence issues from having that large overbite, and they wanted to get started. So this case is an ideal case for a Herbst appliance because we can get started with a Herbst appliance before all the permanent teeth grow in. Plus, it works best in a growing patient. So a Herbst appliance is not something we want to use generally in adults or teens in their later teen years because most of their growth is over. We want to use a Herbst appliance to help to change the direction of the growth, plus also move the teeth as well. So just to kind of review some of our options for treating overbites in growing patients, we could do it with just elastics. So when we looked at this patient, we felt like it was a little too much for just elastics. So if just kind of review what elastics look like when we are doing overbite treatment, you can see if someone has an overbite with braces, you can hook up elastics. And what these generally do is it pulls the top teeth back and the bottom teeth forward. So these will work well in more of the minor to moderate overbites. For this patient in particular, we felt like it was maybe just a little too much treatment needed, a little too much overbite correction needed for just rubber bands alone. So another option we may consider from time is a spring device that helps to correct the overbite. And we'll show you a video of what that looks like. So this one is called a forces spring, and they work pretty well. So they go in, they're very similar to rubber bands, except that they can't be taken out. So they're placed there, usually stay in for about 3 or 4 months or until the overbite's corrected. Basically the mechanism is pretty similar where it pushes the front teeth, the bottom teeth forward and the top teeth back. And so more of the moderate to severe overbites we may consider a forces appliance. This patient was very young, like I mentioned, so it wasn't ideal because we need to have all the teeth in order to consider doing a forces appliance. So another option that we may consider from time to time is extractions. So if you've seen some of our other videos, you may have seen this as well. So this is an animation of what extractions look like. So these are more in definitely severe cases where the front teeth are really forward and we can't get the teeth back far enough and without extraction. So in these cases sometimes they'll have some teeth removed, in this case on the upper, and that allows us to pull those front teeth back. So for our patient, like I mentioned, we decided to go with a Herbst appliance because one, he didn't have all of his permanent teeth in yet, so we could get started with it right away. Also, he was still growing, and we felt like we could use that growth to help to correct the bite. And so we'll show you in this animation here how a Herbst appliance works. Again, it's placed in a young growing patient, and you can see here the appliance is cemented in, generally in a patient that may still have some baby teeth remaining. And there's a portion that goes on the top and a portion that goes on the bottom, and then this little rod is placed between the two. And what this rod does is it actually forces the patient to posture their mandible forward, their lower jaw forward. And as the jaw is held in that forward position, if they are still growing, they generally will grow into that position. And so that relies on redirecting the growth and allowing that growth to help to correct the overbite. So again, this is our patient. You can see here he had that very large overbite. The front teeth were very protrusive. And looking at his profile, we also felt like he didn't have a lot of chin projection. So a Herbst appliance can help to redirect growth like we mentioned. It doesn't always work exactly like we want it to, but there are times that it can help to redirect growth. So we felt like if we could get some chin projection on this patient, that would be a definite benefit for him as well. So here are his before photos. You can kind of take one last look at the baby teeth that are there, that large overbite, and then, like I mentioned, his kind of lacking of a chin on the profile. And here are the final photos once we were done. So you can see he didn't have the greatest oral hygiene. When we removed his braces, his gums weren't super happy, but you can kind of ignore that, look past that. You can see his overbite was entirely corrected, and he's looking much better. And just to kind of reference, he does have some permanent retainers. He was not the most compliant patient we ever had, so he wasn't real good with brushing. We felt like maybe some permanent retainers would be the best option just in case he didn't wear his removable retainers. So just to give you some side-by-side, you can see how much correction we were able to get with braces and a Herbst Appliance. And just so you know, we did Herbst Appliance for about 8 months, and then we switched over to braces once all of his permanent teeth were in. So we got most of the bite fixed first, and then we put the braces on to help with the alignment and getting everything perfect. And you can see from the side, he did get a good amount of growth. You can see he was pretty young when he started, and this was about 2.5 years of treatment between the Herbst Appliance and braces, so he grew up quite a bit. And he did develop more of a chin projection, so we felt like that was a definite benefit to him as well. And we can tell that he really got rid of that overbite, which was causing his issues, and that lip trap, the lip habit that he had was definitely removed as well. So that is our case here. So you can see kind of the criteria we choose for when a Herbst appliance is appropriate. It's not the right appliance for every person with an overbite, but in certain cases, especially young growing patients that may still have some baby teeth in, it's a great appliance to use. So if you have any questions about Herbst Appliance, ask them in the comment section below. If you haven't yet, like and subscribe to the channel, and we'll talk to you soon. Thanks so much. Bye-bye.